In first-of-its-kind research led by a University of Massachusetts Amherst psychotherapy researcher, mental health care patients matched with therapists who had a strong track record of treating the patient's primary concerns had better results than patients who were not so matched. In addition, this match effect was even more beneficial and pronounced for patients with more severe problems and for those who identified as racial or ethnic minorities. The findings are published in JAMA Psychiatry and the Journal of Consulting and Clinical Psychology. One of the things we've been learning in our field is that who the therapist is matters, says lead author Michael Constantino, professor of clinical psychology and director of the Psychotherapy Research Lab, who seeks to understand the variability of outcomes among patients receiving mental health. Earlier on, there was a heavier emphasis on what the treatment was as opposed to who was delivering it. Constantino and colleagues have discovered, for example, that psychotherapists possess relative strengths and weaknesses in treating different types of mental health problems. The researchers conducted a randomized clinical trial involving 48 therapists and 218 outpatients at 6 community clinics in a healthcare system in Cleveland, Ohio. They used a matching system based on how well a therapist has historically treated patients with the same concerns. The matching relied on a multidimensional outcomes tool called the Treatment Outcome Package, TOP, which assesses 12 symptomatic or functional domains: depression, quality of life, mania, panic or somatic anxiety, psychosis, substance misuse, social conflict, sexual functioning, sleep, suicidality. The matched group was compared to a group of patients who were case assigned as usual, such as by therapist availability or convenience of office location. To qualify for matching, the therapists had to have completed a minimum of 15 cases with patients who had completed the TOP before and after treatment. For the trial, neither the patients nor the therapists knew if they had been matched or were case assigned as usual. The finding that the improvement in the matched group was even greater among people who identified as racial or ethnic minorities may provide a way to address and improve mental health care access and quality in traditionally underserved populations, Constantino says. The JAMA Psychiatry paper concludes, notably, the good fit in this study came not from changing what the therapists did in their treatment, but rather who they treated. Thanks for watching. Please subscribe my channel for more updates.